First thing you do, you massage the scalp in circles. Palpate for any abnormalities. Range of motion of the head. Go back and forth. And you check the face. Check for any abnormalities. Check the ears. Check the jaws. Check the muscles. Ask the patient to raise their eyebrows up and down. And also you can check their gaze. Have them look, follow your finger. And you check your pen light. And you check pupils. Okay. Ask the patient open their mouth and say ah. Check the palate. Check for the tongue moving back and forth. And you check for the lymph nodes. Yep. Also, you check the ears again. You have an otoscope. Using the otoscope, check the ears. Okay. And you do a whisper test. Ask them, can you hear the sounds? Can you hear me? Think outside, can you hear me? And you check your neck, you check for the trachea, make sure it's midline. Ask them to swallow, ask them if there's any pain. Okay. Then you come down to the shoulders, you check your shoulders, check the chest to see if there's any abnormalities. You look for the rise and fall of the chest. Make sure the breathing is equal. And you listen, the lungs. Okay. You also visually inspect the chest to see if there's any abnormalities. Check the nipples to see if there's any leakage or anything of that issue. And you can also, then you go back and you check to listen to the heart. Try to get all 4 regions of the heart. You also use the bell sign. And now you can also go down to the stomach area to listen for the bowel signs, all 4 quadrants. Okay. Okay. You can also look and inspect and palpate. You can do your deep palpation for any pain, tenderness. You do light palpation. And you do your percussion for any rebound tenderness. Right here you can also check range of motion in the arms, wrists, shoulders on both sides. Okay. Now you can check the cervical spine in the back. And you can have your patient sit up or roll over. Since I'm using a mannequin, have him roll over to me. Oh, that was the mannequin. You check the spine. At that point, make sure this is locked. And you come down and you check the lower extremities. Check for motion, the knees, hips, ankle, the knees, hips, and the ankle. Okay. You check for the dorsalis pedis pulse, see if they're equal and bilateral. And then check for your pulse. You need to make sure it's equal and bilateral. Okay. You check for your pulse in your wrist. Then I do not have a repercussion hammer, so but you would check for your reflexes. You would have it on here, you hit on the tendon. So you make sure on both sides. Reflexes. And here, you would get right below the kneecap, right below the patella. You would tap, see if any reflexes. And you would do your Babinski test. You would take a pen or something to stroke the bottom of the foot, both feet, to see if there are any reactions. And that is a quick, comprehensive exam.